Everyone. Thank you for joining us tonight for our college and career panel. Today, we're discussing STEM and healthcare. A little bit about the Center for Excellence in Education. It was founded in 1983 by Joanne DeGennaro and Admiral Rickover, the father of the nuclear navy and civilian uses of nuclear power, with the mission to nurture high school and university scholars to careers of excellence and leadership in STEM. There's 4 programs here at the Center for Excellence in Education. We have our Research Science Institute, the USA Biolympiad, the Teacher Enrichment Program, and our newest initiative, STEM Life. And just to go in deeper about each of these programs, our RSI is a highly competitive 6-week summer science and engineering program that's open to rising high school seniors. Juniors are eligible to apply, but seniors are not. RSI is the first cost-free summer science and engineering program that combines on-campus coursework and scientific with off-campus coursework and science and technology research. We also have our USABO, which is the premier biology competition for high school students in the United States. It provides the motivation, curricular resources, and skills training to take them beyond their classroom experience to the levels of international competitiveness. And since CEE began administrating the USABO in 2003, every member of the USA Biolympiad team has been medaled at the IBO. We also have our Teacher Enrichment Program, which provides opportunities for middle and high school teachers to connect with leading experts from industry and academia and explore cutting-edge research and development while making meaningful professional links with direct benefits for you and your students. And lastly, we have our newest initiative, the STEM Lyceums Program. It's a virtual club for high school students to engage in discussions and exploration of STEM and concepts of career pathways. If you feel like your students might be interested in this, you can get in contact with our new program manager, Erica Mack. Our speakers today, we have Dr. Megan Chung, who is a retired obstetricianist and gynecologist. She is an RSI from 1988 to 89. And we also have Shirley Bazdar, our Claude Moore Scholars Program Manager at the Claude Moore Charitable Foundation. We're going to begin with Dr. Chung, and she's going to present to us more about her background in healthcare.
I am a maternal fetal medicine physician, and towards sort of the tail end of COVID, I did retire. Maternal fetal medicine is the care of high-risk pregnancies from both a sick mother or a sick baby. And so during COVID, we had a number of moms who were in the unit and were very sick. And I just wanted to talk a little bit about how I got to my career path and sort of how kids can become doctors or other medical professionals and the different medical professionals that I would deal with on kind of a day-to-day basis. I wanted to say thank you for including me in the virtual college and career panel. There are major healthcare disparities, and the CDC says to build a healthier America for all, we must confront the systems and policies that have resulted in generational injustice that has given rise to racial and ethnic health inequalities. So the National Academy of Medicine and the Association of American Medical Colleges and other organizations have called for greater diversity in the healthcare workforce to address disparities in care. So any efforts in encouraging high school students, especially in historically underrepresented minorities and underrepresented areas of the country, to visualize themselves as part of the healthcare solution is to be applauded. So thank you for including me in this endeavor. Next slide. So a little bit about me. I am Megan Coe for work purposes, and I attended the Research Science Institute when it was at Georgetown. So way back when in 1988, and I was a counselor in 1989 there. At that time, I was really interested in physics and I wanted to be an astronaut, but I get altitude sickness. And I had the opportunity to work at the NASA Goddard Space Flight Center in the Department of Extraterrestrial Physics under Ronald Lepping. And we looked at mathematical mapping of geomagnetic plasmids. And it was a really interesting and fun way to use math and physics. And there weren't a lot of girls at that time that were interested in math and physics and STEM related fields. In fact, there weren't that many women physicians entering the field at that time as well. So being at RSI gave me the confidence to pursue a STEM related field, and it gave me a taste of research, which I did really enjoy doing. I attended the University of Miami Honors Program in medical education, which is a combined BS-MD 6-year medical program that you get admitted to out of high school. And it was 2 years on the undergraduate campus for University of Miami, which was really fun and exciting. We had a great football team at the time. I was in private practice for about 3 years, just doing general OBGYN. And then I decided that I needed more of a challenge, and I was interested in taking care of more critically ill patients. So I did a fellowship in maternal fetal medicine at Loyola University Medical Center in Chicago. And then I was the assistant professor there for 5 years and the fellowship director for maternal fetal medicine. After that, I went into private practice and I continued to supervise residents and just in general sort of maternal fetal medicine private practice. So my pathway was a little bit different than the average person who wants to be a doctor. If you have a student who expresses an interest in becoming a doctor in high school, I think the courses to take would be biology, physics, chemistry, and an AP science class, and a higher level math class like AP calculus or AP statistics. In high school, you should encourage your students to volunteer or shadow at a doctor's office or hospital. Doing summer research is a great experience if you can have it. And some kids I know have worked as pharmacy techs in training, and you can, go on Albertson's website or Jewel Lasco's website, and they'll hire kids that are 17 and over to learn how to do that. Or you can, after age 18, train to be an EMT. So all these experiences that occur in high school help to determine if medicine is really what a student wants to do. It also helps make a contact for the student that they could use during college summers to return to a volunteer position or return to a lab if they were doing research. Something to keep in mind that when students are applying to medical school out of college, medical schools are looking at the last 4 or 5 years of what a student has done. So generally, research, unless there's an actual publication in high school, it doesn't count as much for your application to medical school. If you are applying for a combined MD/BS program out of high school, then of course, doing the most rigorous curriculum, getting the highest scores, and doing research is extremely helpful for that. I've included on this slide a few links where students can actually in high school get experience during the summer in a lab or in a preclinical program. And some of them are free and some of them are not. Most of the applications are due sort of in February of the winter prior to the summer. And then most of these things are like a 6-week type of internship, but it's hard for a student to find, a high school student to find an opportunity. The other way to find an opportunity when you're in high school is to just talk to your pediatrician and see if you can shadow your pediatrician and get some experience that way. And most hospitals also have sort of volunteer opportunities for students who are 16 and over. So those are the kind of the 3 ways to get involved when you are in high school. In college, you need to obtain an undergraduate degree, a 4-year degree with pre-med classes, usually majoring in biology or chemistry or something that would make taking those pre-med classes also count towards your major. The classes that are required are biology, chemistry, organic chemistry, biochemistry, physics, calculus, plus or minus with statistics, and usually English. Recommended but not required would be genetics or ethics. Each medical school has different requirements for the humanities that they want their students to take. During college, your extracurricular activities should also include research with a possible publication, if possible, volunteer or shadowing at a hospital or a health-related field. The timeline for applying to medical school is starts in May of junior year. You take the MCAT, and some people take something called a CASPER, which is a personality test that some medical schools require. You ask for letters of recommendation, you write an essay, and then in June, the primary application is usually turned in, and then you hear back from medical schools and get offered a secondary application to fill out. And then if you pass through the secondary application process, then you get an interview in fall of senior year, and then hopefully get into medical school. It is becoming more and more common for students to take a gap year after college to have more prep time for the MCAT and to do research or volunteer work to help their application to medical school. Around almost half of students now are taking that gap year after college. So that extra year is often unpaid, and it can become expensive. So looking for a paid internship through NIH or through other opportunities is pretty important. The MCAT and your GPA combined are major determinants of many med schools as to whether the student is offered a secondary application or an interview. So sometimes a student will say, I want to be a doctor, and so I'm going to go to, the best college, the most rigorous college I could ever go to. And what ends up happening is it becomes more difficult for them to have good grades and also be socially, emotionally okay, where they're not completely stressed out. So it is important for students when they are deciding to be pre-meds to go to a school where they feel like they could succeed, especially because a lot of these large lab classes like biology, physics, and chemistry and organic chemistry in many schools are graded on a curve. And if you're with the most rigorous students, somebody's got to be at the bottom of that curve, and your GPA could go down, and then it will be more difficult for you to get into medical school. So I think that the important thing is to focus on a fit, social, emotionally. Go somewhere where you can find your people, make friends, have a rigorous learning opportunity, but also have the time to explore. 46% of students applying to medical school are accepted to at least one medical school. And then when applying to medical school, if there is a particular specialty that you've already decided in, you may want to look and see which medical school matches best in that particular specialty. So that would be the traditional pathway to get into medical school and to become a doctor. There is also combined BS-MD programs because, only 46% of kids applying to medical school get into medical school. It's become more and more difficult for students to actually get into medical school. So some students will choose to do a BS-MD program where you're accepted out of high school into the medical school. These programs are applied to in high school at senior year, usually, through the Common App. They usually require you to have an interview, a high GPA, and scores, and everything that is required to get into a rigorous learning activity environment. And then almost all programs, once you get into college, have a required GPA that you're required to maintain. I think ours was 3.6 at the University of Miami. All these schools in college require the same prerequisite science courses, and some of these programs will not allow you to matriculate to the medical school if you don't obtain a MCAT score. Some programs will not allow you to matriculate to the medical school if you don't obtain a very high MCAT score in the 90th percentile and do research and get some good letters of recommendation. So when looking at those programs, that's not really a sure thing. And if you are someone who's going to get an MCAT score in the 90th percentile and get great letters of recommendation and do 2 years of research, it's likely that you'll get into medical school anyway, and that might not be, going to that particular program may not be the best option for you. Acceptance to combined BSMD programs is based on usually standardized test scores, grades, your academic rigor of your high school courses, your interview and letters of recommendations, and your essays. There are some programs that are accelerated, where you do 2 or 3 years of undergraduate work and then get moved to the 4 years of medical school, so 6 or 7 years instead of the 8 years. I've included a link that has the list of combined programs that there are from the American Medical College Association. And there are also other programs that you can apply to after your first year of college. The benefit to doing a combined BSMD program is that it should be a place that takes the stress of applying to medical school off. Now you've worked really hard, you've decided that you're going to go into medicine, it's your life's dream. So now you're going to go to college, and you can take a little bit of a breather, and just maintain your grades. And for me, my MCAT score didn't count. So that was a benefit for me. And I just enjoyed college. And then I went on to medical school. The other thing is, very often you will get some merit money for your undergraduate career and or your medical school career in these programs. And then the third thing is, it's cheaper to go in 6 years instead of in 8 years or 9 years if you're taking a gap year. So it can be definitely be financially beneficial to do a shortened program. After you do medical school, you do an internship and a residency and possibly a fellowship. You apply for something called the match, your 4th year of medical school. You've rotated through different places, and then you've decided what specialty you want to do, and then your name goes into a big computer. You rank the top 10 places that you want to go, and the 10 places rank you or don't rank you. And then some big computer algorithm occurs and you get matched. Residency can last from 3 to 12 years, depending on the program. These positions are paid, and then some people go on to do a fellowship for between 1 to 4 years, depending on the program. So I did obstetrics and gynecology, which is a 4-year residency, and then maternal fetal medicine, which was a 3-year residency. Other people will also do a PhD, they'll get an MBA, they'll get a master's in public health, and these all add 2 to 4+ years, depending on what you're researching and how long that takes for you. So that's kind of the path to getting to be a doctor and kind of doing what I did. In our office, we also work with various different medical professionals, which are also great and fantastic jobs. We work with a nurse that was obstetrically certified. So there's ways that you can either be an LPN, which is a licensed practical nurse who works under the supervision of a registered nurse. And that's a 2-year degree. And then they can often work and then convert that into a 4-year degree, the registered nurse. An RN is a registered nurse, and that you would apply to after high school or during high school. You would apply to go there for your college degree, would be in nursing. And then usually for obstetric nursing, you're required to be supervised for 1 or 2 years while you're working, just so that you can gain more experience. Our office also had a registered dietitian to help care for patients with gestational diabetes and other issues. And a registered dietitian is a 4-year college degree, usually majoring in nutrition, including biology, chemistry, physics, and usually they have to do volunteer work. And then there's a required master's degree, which includes over 1,000 hours of patient care, inpatient and outpatient care, clinical setting and training. And then our dietitian also had additional certifications as a diabetic educator, which required several more years of training. So a registered dietitian is kind of a great job. The dietitian really can help improve outcomes and help people when they are sick become healthier. So, but it is a little bit of a longer pathway. It is, college and then a master's degree. We also work with specially trained sonographer who uses the ultrasound machine for us and helps us read the ultrasounds. And that's a 2-year degree. And then our sonographer was also certified in fetal echocardiogram, so she could do ultrasound of the baby's heart in utero, which was an additional year of training. And then all of our maternal fetal medicine, which is the high risk, where we're looking at significant abnormalities of babies inside the uterus, they were also required to have at least 3 to 5 years of experience prior to working in our office. So again, really interesting job in the medical field. It can be a longer path depending on how long you want to certify, but it's just something that most people, don't think about when they think about going into the medical field. And then finally, I wanted to talk about our genetic counselor, which is a field that's up and coming. They say they're going to need like 29% more genetic counselors every year, just to help people understand what we are learning about. So a genetic counselor assesses a client's need, a risk for a variety of inherited conditions, such as birth defects or cancer. They use family history, genetic testing to assess the likelihood of a disease occurring. And then they help patients interpret results and counsel them to assist them in making treatment decisions, right? We have all these genes that we've found out about. What do they mean when we find an abnormality? What does it mean for the baby? What does it mean for mom if they have a family history of cancer? What kind of interventions do we need to be doing? And also, they're counselors, so they help patients work through difficult decisions. Being a genetic counselor requires a bachelor's degree that includes coursework in genetics, biology, biochemistry, psychology, and statistics. They also have some, in order to get into the master's program, usually they have some volunteer work involved in patient advocacy, counseling, lab work, or healthcare volunteer work. And then they go on to obtain their master's degree in an accredited program. They're usually 2 years long, and they have to work under a genetic counselor, seeing patients, as well as complete coursework in human genetics, psychosocial counseling, bioethics, research methodology, genetic testing technology, and more. So, it's a pretty important job. We get a lot of data that comes through. We're getting more and more data about fetuses in utero just from, drawing mom's blood, and just to be able to interpret that and what those genetic abnormalities or genetic differences might mean for a baby is difficult. And so it really helps to have a genetic counselor on board on the team. So that's kind of our team. There are other people in the medical field, such as respiratory therapists and physical therapists and audiologists, just a bunch of, different healthcare things that you could be involved in. But those are the people that I work with kind of on a daily basis. And if you have any questions about those paths, I'm happy to answer them. Thank you.
Thank you so much, Dr. Ko, for that wealth of information. I'm sure it will be very useful for our teachers and rising high school juniors and seniors, and also our college students as well. I know those combined BS and MD programs might be of interest to our STEM Lyceums demographic, because there are very bright students there who may be looking to start research or those volunteer programs in high school. Now I'm going to pass it over to Shirley Bazdar from the Claude Moore Foundation. She's going to discuss about our Claude Moore Scholars Program.
Okay, good evening. Not a doctor. I'm an educator, a retired educator since 2016. My background is in Virginia. I was the director of career and technical adult and alternative ed in Loudoun County, Virginia. There's a name in the news. And so for the last, half of my 30 years, I had that role, formerly a high school principal and a high school teacher. I do not have a health sciences background, but as an instructional leader in career and technical ed programming, I was awarded the first grant from Claude Moore Charitable Foundation in 2005 to begin what was to be called the Claude Moore Scholars Program. Long and short of it is, our benefactor, Dr. Claude Moore, was kind of a person who put himself through the University of Virginia, very poor, went through world wars, served as a medic, basically became a doctor of radiology, the first at the George Washington University in Washington, D.C. And so Dr. Moore's legacy of healthcare and medicine really transcends the goals of this foundation to incentivize and to help, particularly targeting high school students have an interest in this area. Grants are given to localities. They are not given to individual students. It's a grant for a locality to begin high wage, high demand healthcare workforce programs. So we are now in our 16th year and have served well over 22,000 students within the Commonwealth of Virginia. We are in 48 school systems, soon to be the mid-50s. We're closing out our grant application process and invitations actually tomorrow. So just a little bit about how Claude Moore Scholars evolved, and it really was due to the emerging healthcare workforce needs. When I began this work in 2005, we worked with our local hospital partners and really identified areas where there were shortages. So I'm going to shift my bar down here and do my slideshow. I'm going to run through these fairly briefly, just so you have an idea. And so we worked with Deloitte in 2020 to really just kind of look at our program and, just a little bit, and I'll share these out with our CEE partners, that just talks about the program, our progress to date, which I just went forward, and then, going forward, that really using data-driven decision-making to help localities make good decisions. So in the Northern Virginia, DC, Maryland, Virginia area, there's a lot of IT, and it's often called, the Dulles Airport corridor of IT is very similar to the West Coast IT corridors. And what we started seeing was much like the IT tech talent pipeline, we saw the health science more as a highway, that you are getting on and off ramps, and that it's about portable credentials. It's about, concurrent dual enrollment credit, the transferability, the partnership with community college and 4+ year institutions, as well as employers. So many of our grantees are programs led by local school systems, the higher education partners, or the employers. So, each of those models is designed to address specific needs in that region and in those communities. So as you see here, very briefly, we start that education back in the middle school with providing early engagement. There are courses in the Virginia curriculum in health sciences that can give students an opportunity to test drive some of these certain areas. So in the very first grant ideation in Loudoun County in 2005, that program was propped up and began in 2007. We identified we already had a school of practical nursing at our center. So what we did was evolve and write programming for medical laboratory tech, pharmacy tech, and radiologic and imaging tech. So those were positions that were in high demand in those regions. So we did that curriculum writing in partnership with the Department of Ed, and now anyone in the Commonwealth can teach any one of those courses. In addition to that, there already was a surgical tech program. There already was emergency medical technician. There were a variety of things that now out of the nursing side have morphed into patient care tech, med tech. There's a whole lot of opportunities to enter into a variety of pathways. But as you see in this model, incentivizing them in high school, giving the coursework, providing an opportunity for maybe internships, clinical rotations, observations, mentorships to kind of give kids much as Dr. Chung had, talked about having, doctors maybe have you shadow for a day. All those experiences really help cement the experience. What's great about Claude Moore Scholars is working with community college and higher ed partners, we're able to, have them garner a level of credentials, whether that be, something that's going to be an entry-level tech on up to licensed practical nurse transitioning into the community colleges and the RN program. But also that, students have that portability and that, there are pathways on and off because life isn't always contiguous, as we well know. So we just started looking at some of the data and, looking at the increasing demand for health services. And, again, here, this is Virginia specific data. 2.2 million Virginians live with at least one chronic disease, with treatment costs that account for $24.6 billion of the Commonwealth's budget. So we really looked at, workforce growth here between 2014 and 2019. And now we're in 2023 that, post-pandemic, this was pre-pandemic, post-pandemic, we see that really changing. We also did just kind of a components of success for potential stakeholders. I'm not going to go through that with you. We also did a lot of this workforce work in cooperation with our state government and with local and regional agencies. So what we tried to do was prepare a document that would address each of those targeted populations. And as you can see here, we additionally, for us, health sciences is not only physical health, it's also behavioral health. It also bleeds into health and human services, people that are clinical social workers and people that work with families and work in communities. Very important, but this all, serves to say, obviously, the jobs and the opportunities are growing. These were some of the partners in this project, as you can see: hospital systems, higher ed, and, really, I think was important work for us to do. So I'm going to share my screen again, and I'm going to go back to kind of an overview that we did of our Claude Moore Scholars Program. And so, ideally, these are the goals of the program that do target high school students taking coursework within health sciences, but we also do have a number of growing middle school elective programs that give kids at the middle school level kind of an elective opportunity to learn more about health science careers. And so, as you can see, obviously, the role of the program is to influence and represent at the state level, to catalyze and engage the startup support to grantees. That's what philanthropy can do. Philanthropy, like Claude Moore Charitable Foundation, can come in and provide things that taxpayer money, operating budget monies can't necessarily buy. State or federal monies cannot buy. An example of that is, as students enter into the first year of the program, they are white coated. So a lot of localities use this to provide a very nice, with our logo, white coat to students in an official ceremony to make them feel professional from the beginning. Many of them also supply the kids to have scrubs that also have that logo, that's how they go to class and or their clinicals or their internships or their other observations. And so again, setting them apart from every other student in their high school. And then certainly, we seek to network and convene. A lot of the work that we do is bringing together resources and matching up, those opportunities that we see between potential partners, between potential collaborators, and kind of being the connect the dots there. That's something that, I believe that we do a very good job of connecting and making connections, as well as funding. Our traditional funding really goes for about 5 years. And there's a startup and a planning phase in that, as well as, a maintenance there toward the end. So again, as you can see here, our partnership engagement, again, with Virginia Public School Systems and the, higher ed and healthcare employers, you can see these are some of the programs here that I mentioned: licensed practical nursing or certified nursing assistant, EMT, medical lab, pharmacy, radiology, surgical, health informatics. This is older data. I have told you since the inception of the program in 2007, over almost 22,000 students have participated. But this current school year, it's about 7,500 that are across the Commonwealth of Virginia. And again, they have access to the curricula, connection points to higher ed, these mentorship and community networks, clinical observations and rotations, employment placement, and then keeping jobs in their local community. And again, it takes the public school systems, the post-secondary academics, and the healthcare employers to make all that work. So in Virginia, there are a lot of educational initiatives that are focused on healthcare. And what we've tried to do is to bridge some of those together. So you will see particularly some of these initiatives are at the community college level. And you'll see that through things like the Virginia Ready and the G3 initiative, which provides total funding and support, wraparound support scholarships to individual students at the community college level, as well as the Virginia Ready. I'm happy to tell you that the current governor here in Virginia has approved for the next year and will hopefully be moving ahead that some of that Virginia Ready and G3 money can be used for high school students to take those dual enrollment college credits, building a transcript, building experience, and stackable credentials. The Virginia Health Workforce Development Authority, they basically are the overarching institute of the area health education centers, the AHECs, and there are several of those located throughout the Commonwealth of Virginia. And then there's the Claude Moore efforts. So when we really just took a global look at workforce, we wanted to make sure that we tied all those pieces together. Again, what we've tried to do is to look at pathways for students so that they understand how to navigate back to that highway model, how to navigate that. So, it's everything from non-clinical, non-specialized on up to bachelor's degree and licensed certified positions. So we do that with each of the cohorts that we fund, and it's very clear to students how to navigate and parents those pathways, because the biggest part of the education is not only the students, it's the parents. And for us, when there are kids that do not have a legacy of higher education and do not know how to navigate that, we want to supplant local school system efforts to make sure that that is happening and that counselors have the best information to help them make informed decisions that are career important. Again, our recommended best practices are early student engagement. If we can reach down into middle school, but particularly high school kids, a lot of our programs have summer camps, conferences, local business community meetings, career fairs. I mentioned the white coat ceremony. These immersive experiences, opportunities for all kids is really important. We look at the leadership and how there needs to be a point of contact who's going to help navigate that highway with students, and then the collaboration and parent advisory group. So it's a little bit about Claude Moore Scholars Program. I hope that that was helpful to you. Right now, this program is only in Virginia. Once we get to all of the public school systems in Virginia, I think there is a desire to go outside of the borders. But for right now, it is a model that has been looked at by a lot of other states. And I do know that Senators Kane and Warner have been very interested in our work here in Virginia.
Thank you so much, Shirley. That was great information. I think those partnerships with the VA schools can be beneficial for so many students, and the initiatives that this Claude Moore program has is amazing. Because of time, I'm going to go ahead and forego our Q&A session. I will put you in direct contact with Shirley and Dr. Ko so that any questions you have, you can go ahead and forward to them. I really want to emphasize that join TEP's LinkedIn group. I think this is a great way for teachers and students to connect with each other and our speakers and industry professionals and ask any questions or share any updates you have that would be useful for other teachers as well. Thank you again for joining us. The Teacher Enrichment Program's major sponsors include Akamai Foundation, the Claude Moore Foundation, Equitrans, Lockheed Martin, and the May Family Foundation, TC Energy, and Vulcan Materials. Thank you once again for coming out and taking time of your day to speak to our teachers. And thank you so much, participants, for coming and listening. Feel free to scan this QR code in the corner to join our next event, which will be on oceanography. Thank you so much.